Good evening, everybody. Thank you so much for joining us for today's presentation, Bringing Lupus Nephritis Out of the Shadows, presented by me, Dr. Alvin Wells, and sponsored by Aurinia Pharmaceuticals and GlaxoSmithKline. I'm Mary DeLear. I'm with the Lupus Society of Illinois, and we are going to get started in just a minute. I just have a couple of announcements. Our next educational event is coming up May 27th at 6 p.m. It's called Caring for Someone with Lupus. Should be another wonderful topic. We are recording this presentation and we will be posting it on our website within the next couple of weeks. And finally, I do want to go through our just some information. This event is for educational and informational purposes only and serves to benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not substitute or replace expert medical care. Before making changes to your medical care, consult your qualified healthcare professionals familiar with your medical condition and health status. So now, without any further ado, I wanted to introduce Catherine Thorson, who is a registered dietitian and is a regional professional relations and patient advocacy for Aurinia Pharmaceuticals. She's a registered dietitian for over 25 years and has worked in diabetes education and dialysis and spent 15 years in rheumatology and immunology. At Aurinia, she works with thought leaders in patient advocacy groups and lupus nephritis. Welcome, Catherine.
Thank you so much. I appreciate the introduction. It's my pleasure to introduce Dr. Alvin Wells, who is currently a practicing rheumatologist at the Aurora Rheumatology and Immunotherapy Center in Franklin, Wisconsin, where he serves as the director. He is an assistant clinical professor at the Medical College of Wisconsin and a visiting foreign professor at the Karolinska Institute in Stockholm, Sweden. He also maintains his clinical affiliation with Duke University Medical Center in Durham, North Carolina, where he is an adjunct assistant professor. He is a member of the American Telemedicine Association and of the American College of Rheumatology. Dr. Wells has over 25 years of research experience focusing on clinical inflammatory diseases. Dr. Wells is an international renowned speaker and researcher, and in 2019, he received the Outstanding Teaching Award from the Medical College of Wisconsin and Ascension St. Joseph Hospital. Ladies and gentlemen, please help me welcome Dr. Alvin Wells. Dr. Wells, you can take it away.
Yeah, I'm not going to step on the toes of your doctor, but here's the one thing you do. I'll tell people right up front, you are in the driver's seat. It's the patients with lupus. You're my customers. Pay me money for my best advice, and that's what we're going to get. So tonight we're going to talk about highlighting lupus nephritis and really bringing it out of the shadows. I like this title because that's what we are now too as well. I do have to say this presentation is sponsored on behalf of Aurinia. I've been chosen by them to do the presentation. I am getting paid to do this presentation. She said these are my introductions and she said my affiliation. So let's first talk about what is lupus and lupus nephritis. I'm going to need to minimize all of this stuff up on my computer. Here we go. So lupus is a serious disease. Many of you know lupus comes from the Latin word that means wolf. So you get this rash in your face that looks like a wolf or a German shepherd. Patients with lupus can lose their hair. They can get a rash. They can get sores in the nose and the mouth. And that's just on the outside of the body. What we get worried about as a rheumatologist, what it does inside of the body. Because again, being a serious chronic disease, it does have many complications. Because what happens, the immune system goes haywire, and these angry cells start attacking the body, start attacking the skin, start attacking the hair, and it also starts attacking the kidneys. And when we talk about lupus nephritis, this is a condition that it affects patients. And here's the thing we know about. In the lupus community, about 50% of people living with lupus will go on and get kidney involvement at some time throughout the course of their disease. And that's the stuff that we see. Just click on that again. I think I need to go down here. There we go. So lupus nephritis is a common complication and involves the kidneys. And we say the inflammation, like I said, the analogy is you get the rash, you get the hair loss. Imagine if you get the inflammation inside of the kidneys, and that's the thing that we see. The kidneys cannot function properly. And therefore, to remove the waste that it normally does when you urinate, that stuff builds up into the body. In severe cases, what we call end-stage or chronic kidney disease, patients have to go on to get nephritis. Here's a take-home message. Lupus nephritis can create serious health problems. It can cause permanent damage and can even lead to kidney failure, which is what we want to try to prevent. So who gets affected by lupus nephritis? And I kind of give you a little snapshot of what these patients kind of look like. We know that it's not that as uncommon as many people think. Look at the numbers here. If you talk about in the U.S., about 100,000 people are currently diagnosed and living with lupus nephritis. Of these, 1 in 3 are diagnosed with lupus nephritis at the time of diagnosis. So think about that. I usually see about 6 patients a day. Some of these are lupus patients, and a new patient walks into, I take it back, I see 6 new patients. I see more than 6 patients a day. I see 6 new patients a day. So if I have a new lupus patient who walks into my clinic today, 1/3 of those patients with lupus are going to have lupus nephritis at the diagnosis. And that's the thing we talk about. As we talk about when making that diagnosis, and we're going to talk about very, very aggressive treatment. I'm not going to go through all the different treatment options and everything tonight. There's a lot of different things. You want to talk with that with your rheumatologist and your nephrologist here as well. But in the U.S., we know that the racial and ethnic groups have a higher rate of lupus nephritis. So compared to white patients, patients who are African American or Asian, they're 4 times higher likelihood to have lupus nephritis, and again, twice as many Hispanics and Native Americans will have it compared to the white population. So it's out there, and that's why you see some of the pictures of the patients in these slides. Hopefully that recognizes, you can recognize those and it resonates with you, because that's who we do see. And as we know, lupus is in itself is more common in men, more common in women than it is in men. And the same thing with kidney disease is more common in women than in men, and is often more severe in those patients who do end up getting affected from the disease. So we talk about the lupus nephritis, and think about these people. What are the signs and symptoms that we see when you think about that? So imagine the kidneys should be not normally functioning properly. If they don't function properly, then we see some signs that we can talk about that. So your body retains fluid. You usually get swelling in the lower parts of your body. We talk about the legs, the feet, or the ankles. You know, because that fluid builds up, people get weight gain. They can go to bed and then wake up in the morning, they've gained 2 or 3 pounds because the body hasn't gotten rid of that fluid overnight, and you can see that. And then with the body's attempt to get rid of the fluid, there's increased urination, especially at night. People they wake up 2 or 3 times at night to go to the bathroom to help to get rid of some of the excess kidneys. And here's one little thing here too. I remember, I'm old, giving my age away. Remember, you get the little cartons of milk as a kid, you put the straw in, then you blow that straw, and you see those bubbles bubbling in that milk. That's the analogy I make when I think about what the urine looks like. It looks foamy, or bubbly, or frothy. And some people say that it doesn't really smell, that should not be any odor, but you look at it and say, wow, it looks all foamy and bubbly. That's a sign that the kidneys are not functioning properly. It's difficult to diagnose this lupus nephritis on physical exams alone, so we have to rely on some other things. We're looking for leakage of protein in the urine, what we call proteinuria. We also look for red blood cells in the urine, which we call hematuria, and also abnormal electrolytes, looking at just sodium, potassium, magnesium, phosphorus, all those different things we look at. The kidneys we look at too. We talk about the glomerular filtration rate. How does the analogy imagine that? So imagine if you open up a fire hose, or you open up a small water hose. The rate of that fluid going through, that's the glomerular filtration rate. Our kidneys should be functioning pretty good. They should go in full stream, almost like a fire hose, right? But in some patients, because they have the kidneys involved with nephritis, guess what? It goes down to a trickle. So you have a decrease in that filtration rate. It's like turning off the spigot or the faucet. You can see that. And as a result, when that gets backed up, then things that we see increase in the blood, like the creatinine. And as a result of that, you retain fluid, you can build up blood, your blood pressure goes up as well. And at the end of the day, because of all the inflammation, you can get some scarring and getting some damage to the kidneys. And unfortunately, when it gets to that point, we can't do a whole lot for it. So the complications related to the lupus nephritis. So again, you have the lupus, it's involved in the kidneys. We talked about the signs and symptoms, but in addition to signs and symptoms, it may cause increase in blood pressure. So think about this, your body retains fluid.
Dr. Wells, I'm sorry to interrupt. We did get a request if you could slow down a little bit. I think some people are taking notes.
Oh, and I thought we'd been recorded too, so we'll go through that as well. So I will slow down.
Thank you, sir.
So increased blood pressure is one of the things that we see with lupus nephritis. And you can see that as it goes up, your body retains fluid. It can lead to chronic kidney disease and scarring of the kidneys, and this also represents the kidney destruction. And as a result, secondary complications like cardiovascular disease, including heart attacks and strokes. And then, of course, at the end of the day, what we want to prevent is end-stage renal disease or kidney failure. and this is where patients have to go on to dialysis. So we want to catch it early, make a diagnosis and treat it to help prevent any irreversible kidney damage. So how do we make that diagnosis? I'm a rheumatologist. We make the diagnosis of lupus. If somebody has skin disease, we can do skin biopsies. We do laboratory tests, and of course we do the physical exam. When it comes to the kidneys, we rely on the nephrologists, the kidney doctors. They can help me do a kidney biopsy. We together can talk about treatment options. So we're going to have a whole team. In the middle of this team, I also put your primary care physician. I need them to take care of your diabetes, your blood pressure. I need them to talk about weight loss and all those other things as well. I'm a different person when I talk slower, so I'm going slower so people can do this. This is not the normal Dr. Wells. The test to help diagnose lupus nephritis, we look at the urine, we look at blood, and we look at a kidney biopsy. The urine, we're looking for blood and protein in the urine. The blood test, we're looking for elevation of the creatinine. And for the kidney biopsy, we're looking for specific changes. A biopsy is a piece of tissue that is taken. We can look at that under the microscope and determine how much inflammation, how many angry cells are there, and how much chronic cells are there, how much damage has occurred in the kidney. It is very important that we do the routine urine testing. And in my practice, we're doing the urine test every 3 to 4 months, because if the patient is stable today, when they come in 3 or 4 months later, I see that kidney function going up, I see things in the urine, then we will talk about maybe even doing a biopsy and maybe even talking about other aggressive therapy to get them under control. So do not be alarmed that every 3 or 4 months, every time you see a rheumatologist, every time you see a nephrologist, they will do blood work, but they will also get urine as well. So when we take a piece of the kidneys from a biopsy, we look at that under the microscope. There are 6 different classes of lupus nephritis. Class 1 is the most minimal one. And on the other side here, you see class 6, which is the most severe one. Let's take class 6. That's what we call advanced disease, scarring disease. You imagine if you got a scar on your skin after surgery, after injury, that scar doesn't go away. The scar is the classes that we worry about when we see most of patients are going to be class 3, 4, or 5. And these are the ones we see some active inflammation, because those are ones we can impact with some of our therapies. So if we see class 3 disease, which involves less than 50% of the kidneys, class 4 disease, which involves more than 50% of the kidneys with angry cells, and then class 5 is another one where we get deposits that kind of settle into the kidney membranes. So these are the classes that we see the most frequently. Again, if they have class 6 in there, unfortunately, none of our medications can reverse that, and that ends on to end-stage renal disease. So how do we manage it in the lupus nephritis? So like I said, first of all, treatment is vital, but by taking an active role in your care, like we say, this is most paramount. I tell people at the end of the day, patients will pay me for the best advice, and we got to put the whole piece of the puzzle together, working with your physician, your nurse practitioner, your physician assistant, learning about what the disease means. A lot of people say, hey, am I going to pass this on to my kids? What can I do to impact it? And think about all the things as any healthcare provider will tell you. You need to, first of all, sleep well, getting 6, 7, 8 hours of sleep at night. You need to diet. So we talk about a low carb, a low sugar diet, increasing amounts of protein and natural fruits and vegetables. I'm not a big fan of vitamins, because I always tell people in the old days, our grandparents couldn't go to Walmart or Target to buy a bottle of vitamins. What did they do? They ate the fresh milk and the fresh cheese and the fresh vegetables and the fresh fruits. And that's what we need to get back to doing, because your body is very smart. If you're taking all these extra supplements and not eating the right food, then your body's going to either it's going to pee most of that stuff out. You're not getting into your body like you think it does. And overall healthy living, that includes, like I said, sleep. That includes it, stopping smoking, all those different things that we know about. And that's what you can do right now when you think about treating your disease. So potential members of the lupus and lupus nephritis healthcare team, we talked about that. So living with lupus, it can mean a different healthcare providers to provide different needs. I already touched on the middle. We talked about the rheumatologist, that's me. We talked about the nephrologist. We also talk about the primary care doctor. I've touched on it already, but they help me with their blood pressure. I help me with the patient's diabetes, their weight, all those different things we see. I'll jump over too, because we work with the dietitians to help. Hey, let's talk about some nutrition for this patient, because how can we manage their diabetes, which can affect the kidneys. So we want to make sure that is not an issue. Unfortunately, lupus affects young patients. You're talking about 18, 19, 20 years old. and 30% of those will have lupus nephritis at the diagnosis. So sometimes people will need a therapist. We talk about a psychologist or a psychiatrist. So those are kind of approaches that we say for our patients to kind of have them. So it's a whole team approach, and you should think about that. If you have, you say, a primary care doctor and a rheumatologist, you might want to get some other specialists involved to help you improve your overall health. So I'm a big fan of working with the healthcare team. So what can I do to help you keep track of your medical appointments and hospital visits? I need to know about those. Hey, Dr. Wells, I was in the hospital recently. This is what my doctor did. Write down your symptoms over a period of time, because you come in today, you might not remember what happened 3 or 4 months ago. I'm one of the doctors that like to have you write down stuff and talk to me about it. If you tell your doctor tell you, no, I don't want to know what happened 3 months ago, and you think that's pertinent, then it might be time for you to find another doctor. Because indeed, I'm not just looking for one snapshot in time. Today, April 27th, I need to know what happened in February and March and April 1st, because all of that might impact how I'm treating your disease. So that's the thing we need to know. Organizing and reaching results from the blood work. Most of the electronic medical records now have an application on your cell phone or your computer. We can look at these things. You need to keep in touch with your immunizations. All that stuff should be up to date so you know what's going on. And the most important thing, I say, bring a list of medications, and not only prescription drugs, but any kind of supplements, any kind of vitamins. Everybody say, oh, I'm taking CBD, I'm doing CBD oil, I'm rubbing this on my skin. All those things are important to know. Don't be embarrassed about what you're doing. I do CBD oil on my knee, so I tell my physician about that. But I couldn't say, hey, this is good, this is bad, if I don't know that you're using those agents. And again, take a family, a friend, member with you along. The only thing is you bring somebody to the room, I'm going to be talking about things that might be personal. You need to make sure that's okay. I will talk about sexual activity. I'm going to talk about a relationship with your spouse or your partner. All of that stuff is going to be happening in the room. I need to know that. It's going to impact my treatment. So you need to be comfortable. Whoever's sitting in the other chair next to you, they want to be able to hear those kind of things. And the most important thing is ask the questions. I love this TV commercial. You guys have seen this, and you show this guy. He goes in to buy a cell phone. He has a whole list of questions. Can it do this? Can it text? Can it take pictures? Can it do all these different things? Then it shows the same guy going to his doctor. He asks, do you have any questions? The man just sit there, no. So don't be like that guy. If you ask questions about a cell phone, you need to ask the same type of question when it comes to your health. And that's the thing we talk with our patients about. And then really what you're working with your team remotely. And last year, everybody started doing telemedicine. I've been doing telemedicine and virtual visits for the last 7 years. So that was easy to me to adapt to where we're seeing people remotely. In March, April, and May last year, we were 100%. We didn't see anybody live. Now we're about 60% live and 40% virtual. And indeed, what I do for all of my new patients, like I said, the 6 new patients I see today, nobody comes back into the clinic in a month to go over the results. All that is done virtually. So every single patient is followed up virtually. Oh, Dr. Wells, I don't have internet access. That's no excuse. You can go to the libraries, the public libraries. You can sit in that room. They can log you into the computer. You can get and connect with your electronic system that way. You can use a phone, a smartphone, those kind of things, advice you need to know. Like we said before, have the questions ready. Write those down. Have somebody with you if you need to. When you're doing these virtual visits, make sure you have the appropriate internet connection. If you need to, like Mary said tonight, you can chat those features down. Some doctors love it, some doctors hate it, because in between my patient visits, I get all these emails and chats. But we have a team of people working with us, my medical assistant, my nurses, who help me to answer those questions. If it's something urgent, they pull me out the room, or they catch me before I go into the next room. We'll talk about that. Remember that the telemedicine or remote visit is a personal visit. So you want to make sure that you're wearing the right clothing in case we need to show you symptoms. I might say, hey, let me see your face, let me look in your mouth, all these kind of things. I had one lady last year was trying to connect with me while she was walking the dog. I had another guy trying to connect with me while he was in the car. So those are not the times. You want to have your phone in a situation just like this, so I can focus on you and you can focus on me as we take those 15 to 20 minutes to address your health issues. And if you can, check your vitals ahead of time. Many of us have now the things like you have a smartwatch that can check your oxygen level, and even your blood pressure, EKG. You might have the things that look at your temperature, your heart rate, and your pulse. All those things are important for us when you're doing these virtual visits, so keep that in mind. If many of you haven't done that, I would recommend you getting that, because again, the days of rushing to a doctor's office, the doctor's running an hour behind, you've taken off on your lunch break, and you're upset because you're running out of time. Or you imagine going to your office or go to at home, and you can have a connection with your doctor right there, and that's what the reality is. Okay, so what about treatments? And again, I'm not going to give any specific drug, any specific name, but I'll give more of the classes of the drugs that we look for when we talk about treating lupus nephritis. Remember, lupus and lupus nephritis is an immune-mediated disease. The body's immune system is going haywire. So instead of having that balance that we usually do when we're young and healthy, something's got the scale kind of tilted like this. So I'm going to give drugs to kind of get that scale back to closest balance. I can't 100% get there, but I want to just suppress the immune system. And that's what these immunosuppressants are. We have a lot of different drugs that are out there. Which one I use is going to be a lot what I talk about in individual patients. Am I treating just the kidney disease? I'm worried about other parts of the body as well. We also talk about steroids. Many of you know steroids, people love them or they hate them. Steroids do have some side effects, but they work very quickly. They can reduce the inflammation in the kidneys. So sometimes we'll use that as a kind of a bridging method, because some other medicines might take several weeks to work to get the results that we want. We also use blood pressure medicines to control the amount of fluid that goes through the kidneys and actually to decrease the blood pressure overall. And as you know, we talk about antimalarials. They not only treat the lupus, but many antimalarials are blood thinners. They help to control blood pressure, and they do a lot of different things like this as well. They also help for fatigue, the joint pain. They do a lot of different things. So most of us will use the antimalarials, and we add these other agents on there based on which condition that we're treating for our patients. All right, what beyond medication? And I think this is the most important thing that we talk about tonight. We talked about the team approach. So you have the rheumatologist, you have a nephrologist, you have a primary care doctor, you might have a psychiatrist, and you might be sent to a nutritionist or dietitian to talk about these things as well, because we know that a proper diet can help manage the disease and lower the blood pressure as well. I already alluded to the low salt diet. I mean, I hope that nobody has salt shakers on the tables at home, and definitely when they go out to a restaurant. You want to avoid processed food. Why? Because it has all this salt in it, so the food is preserved. And again, you talk about eating small portions of protein-rich foods. I already alluded to that. So chicken and fish. I think you should have 3 servings of fish a week. You should have 2 or 3 servings of fruits and vegetables a day. Not just taking some gummy that's got some compressed fruits, got a lot of coloring and things in there. We talk about that stuff. It's got to be the real deal fruits and vegetables. That's what we tell people about it. I know sometimes it can be not that inexpensive, so it could cost money to do natural things. But here you see it's difficult to see. Is that an avocado? Is that an apple? I see this. I see shrimp. I see some lettuce. I see tomatoes and peppers. All those natural things you want to do. I always tell people, talk with your healthcare provider. So you talk about, you hear on Instagram or Snapchat, somebody's talking about this newfangled diet. Before you go out and buy all these shakes and meals and things like that, just have a conversation with your physician and to talk about that as well, because you want to make sure they get the buy-in of whatever you're doing. I can't stress enough exercise. And I tell people, do I have to go out and be running a marathon or buying this new bicycle and treadmill that people are talking about? It can be walking. I tell people starting off walking 10 to 15 minutes 3 times a week, and double that on the weekends. So Monday, Wednesday, and Fridays, I'm gonna walk around the block or at school or in the mall for 15 minutes. And on the weekends, I'm gonna do 30 minutes. So that you do 3 or 4 times a week when you're doing that. We don't like a lot of impact sports and exercise. So walking, swimming, yoga, a elliptical machine, a stationary a bike, all those different things are good for you to help to not only get up your cardiovascular system, make your heart rate go, make you breathe a little bit better. But again, before you go into any routine, talk with your doctor. Sometimes I'll send patients to the physical therapist, let them evaluate their overall health, talk about what deconditioning exercise and things that they can recommend. I tell you, yoga, if anybody's done the real deal yoga is very hard. I exercise every day for 45 minutes, and I find it hard to do this yoga, these poses, and you're sweating and you're stretching and doing all these different things. But with regards to what we're saying, if you're doing low impact things, Tai Chi is very popular among our patients with rheumatology. And one of the nice things about the Illinois Lupus Foundation, because they can get on their site, they have things like that can help you to improve your health. And I think those are really good. At the end of the day, when you do anything like that, just like I say, if you're talking about taking nutritions and vitamins and CBD oil, and the same thing with diet, talk with your physician before you go into anything. I say up front, you are the best advocate. Like I said, you're paying me for the best advice, and that's what we give. But I can't do it by myself. I need the input from you as a patient. Sometimes, like to say, if I have a young lady who's married, she's got kids, I need the input from the family members. Because it might be some days, hey, she's too tired to cook. She can't do the laundries on the weekend. We need the husband to roll his sleeves up and get in there and do some things like this as well. Do I have to go as far and write a script? Yeah, do the laundry 3 times a week as required, something like that. I'll do it. I've done it in the past with patients, just so the spouse can see that, hey, there are some days where she might be struggling. And just like sometimes we do the FMLA, so if you need to take some time off to go to your appointments, to do all the different things, that's what you're paying us for. If your providers are not doing that, you need to say, hey, am I doing the right thing? Be engaged and stay informed every step of the way. You need to know about the diagnosis. You need to come in. One of the things I hate, I have people, oh yeah, I'm taking a blood pressure pill, you know, that blue pill or that purple pill, and that doesn't do it for me. I don't care if you're bringing a whole bag of stuff. I need to look at all those different pills. I need to know what they're there for. You can go to the pharmacies now and say, hey, I'm on these medications. Can you print out the whole list for me? And you do that every time before you go to your doctor's appointment. If there's someone who can do that online, now you can have all those things. That's what the pharmacy is there for. That's why they charge all the money for all these drugs. But you want to be able to get that list, and you can do that for your parents, your family member, or your kids. Hey, give me the list that I'm getting filled here, and so I can take that to my doctor and they can see what we're doing. As we talk about drugs, everything understands the risk, and we know that with the disease as well, that about 50% of people living with lupus will go on to get kidney involvement. And know what to look for. Beyond the physical symptoms, I talk about swelling of the legs and ankles, weight gain, increased blood pressure, urinating at night. We also talk about when, hey, if you're urinating, you see all those bubbles in that urine, that's something to let us know about. Because not only am I looking at examination, I'm looking at your blood work, but I'll do the urine test as well. Discuss your treatment options. Hey, Dr. Wells, I heard about this new drug on the TV, or I read this in the newspaper, or I saw this online. Is this a treatment for me? If your doctor throws that away at your face, no, I don't have time to talk about that, you need another doctor. I can't tell you every single day I have people bring in, hey, I saw this in the Sunday paper. What do you think about that? I said, no, that's experimental. They're going to charge you a lot of money. This is for the people to make money. I said, oh, wow, that's neat. I've heard about that. Let's give that a try. I think this might work for you. Let's see if we get the drug approved. That's the approach we do. If a doctor's not listening to you guys, it's time to go on. People used to think in the old days, doctors are God. I'm going to do whatever they say, sit there with my mouth closed and not do anything. That's not where we are in 2021. You need to be out there, open your voice, you need a mouth, you have to ask questions, all these different things. We talk about that. So, because we need to know, hey, what's going to be right for you might not be right for the next patient. So we individually advise that care and continue to learn. Hey, as I'm talking about new medication, I might be sharing that with you. I might have to change some of your other medications. I might need you to lose more weight. I might need you to increase the protein. We talk about all those different things. That's why the community approach. And at the end of the day, it's not just me as a rheumatologist. I got to have everybody there. I got to have you all in to talk about lupus and your lupus nephritis. And that's where we are in treating this chronic disease. So talk about the 50% risk, talk about what we look for, blood and urine, discuss these things with your healthcare providers, and making sure you're all in the same page as I am as you're treating the disease. So there's some things here. If you look at the all-in for lupusnephritis.com, there's some resources that are out there. Facebook, if people doing Facebook and things like that. And again, you're talking about how you can register for some of these things, looking for lupus awareness. As you talk about, Mary was saying about the walks and some of the other events that were going on locally in your area. Be involved in all those things, because you'd be surprised. You're walking next to somebody and learn, hey, oh, I heard about this new drug. Oh, no, my doctor didn't say anything about me. I've been on the same drug for 15 years, and they hadn't done anything. So that's the kind of thing you need to think about, and that's why you're having these interactions with other people that are in the same situation as you are. All right, I went through it pretty quickly, about 30 minutes there. I want to give some time for some questions and some interactions. So Mary, can you come back on and remind people how to ask questions? And I will see if I can get back to the chat box here. Sure, so why don't we stop now and open up the line for some questions?
Absolutely. So people can chat the questions through the through this app right here, or I'm monitoring my email. So if anyone has a question, you can just go ahead and email me. And while people are taking a look at that, I know you were talking about lupus nephritis. 50% of people will have kidney involvement at some time, right? So yes. Like Nick Cannon has lupus nephritis, and I don't mean to drag him into this, but he would always say I have lupus nephritis. But somebody who has lupus nephritis has lupus, correct?
Oh yeah, so you get lupus first. And again, like I said, so some people with lupus lose their hair, that's alopecia. Some people with lupus, they get that rash on the face. You know, Seal, the singer, he has discoid lupus. There's some people with lupus that get the lung and heart disease, and some people get kidney disease, and that's the lupus nephritis. So lupus first, and underneath that, we have that under that umbrella, we have several different forms that affects different organs of the body.
So lupus nephritis, when that's under control, and there's, you know, you just talked about varying ways that can be under control. You can no longer have lupus nephritis, but you still have lupus, and you still have to be on the lookout for it impacting other organs, right?
That is correct. That is correct. And that's what somebody's asking them in the chat box. That, hey, if you look at patients who are on dialysis, how many of them have lupus nephritis? Thank goodness lupus is still relatively rare. We talk about 100,000 patients in the U.S. With lupus nephritis. And fortunately, not all of them go on to get dialysis, which means end-stage renal disease. The more common things are what we're going to see what drives people end up on dialysis. It's going to be the high blood pressure. It's going to be diabetes. It's going to be obesity. Those are things that we see the most that drives that dialysis population. Unfortunately, still most of those patients are Black patients, and then it's a double-edged sword. They have the diseases, and not as many people sign up for being organ donors to get a kidney transplant.
Okay. Great. You were talking about some things that people can do, and is that considered preventative with lupus? Like there's no lupus diet, but obviously to take care of your kidneys, like the low salt, all of those suggestions that you made, the more protein, those are not specific to lupus nephritis. Those are really lupus in general. Is there any evidence that by maintaining that diet early in your lupus diagnosis that you can avoid lupus nephritis?
Oh, so not so much in water, you can decrease the severity of it. I'm pulling up a slide because somebody asked about the medication one. I'll go back up to that. Because we know that once you get the lupus nephritis, that many people will need to be on medication for a period of time. But the challenging part is, you know, what medication, how much, and how often we need to be able to do that. Let's see if I can do this to kind of see where the slide is with the medication. Somebody was asking me. I'm gonna do like this for a minute because I can't remember all the slides. I'll pull it up like this. Okay, here we go. So does that make sense? So if you look at with the treatments, what we try to do is to limit the severity. So going from class 3 to 4 to 5 to 6. Class 6 is a bad one. Once it's there, we can't do a whole lot. So by decreasing amounts of inflammation, decreasing the active disease, we're hoping to decrease for progression of organ damage, which is the kidneys. And now we have data to show that without drugs now, that we can actually decrease the organ damage that we can see in patients with lupus nephritis.
Okay, great. So people are chatting you directly? Questions?
Yeah, I'm just pulling up the chat box. I'm seeing all the stuff. I thought this is the same thing I'm seeing for you. So I just pull up the little red thing here, my thing. So is this not the same for everybody else?
Well, it looks like they're chatting you privately, which is fine, but just so you know, I don't see it unless it's blue.
Oh, okay.
So if they do send you a question, that's fine.
Yeah, I'll
if you
read
could
the question out. Let me hit to see it for everybody. Now,
Thanks.
are you having other questions coming in for you or through your email?
Nope, go right ahead.
So no, that was it. I think we talked about the dialysis. Oh, somebody said most people don't understand the relationship between blood pressure and kidney disease. Can you elaborate? So yes, one of the things we hate with let's take a step back. So a lot of different things can damage the kidneys. So man, imagine if I spray a water hose at a door screen, or I spray a water hose at a fire hose at a door screen. That fire hose, right, is going to damage the screen more. And that's the analogy we make. So the more pressure going through the kidneys, the higher the blood pressure, that's actually going to lead to more damage. So by lowering the pressure, by lowering the blood pressure, I can prevent any damage to the kidneys. And this is why I think it's a sin. You have a lot of people who have high blood pressure. They don't go to the doctors. They don't have it controlled. They can end up with kidney disease, end up with damage, and then going on to dialysis. So this is why if you look at the medication list, we control the inflammation, immunosuppressants. I get a quicker response with steroids, but I'm also using blood pressure medications. So I'm not letting that fire hose aiming at the screen. I'm going to have like a little trickle, which is going to be a normal amount to going through that area as well. So the controlling the blood pressure is actually the key for us in what lupus nephritis.
Yeah, you were just talking about steroids, and during your presentation, you were like, some people love them, some people hate them. I've never met anyone who loves them for the long term.
I know.
Does prolonged steroid use, does that impact the kidneys?
Yeah, you know, we're learning a lot about the steroids now. They are double-edged sword. Like I said, we think they help, but now we know that every time you use steroids, particularly higher dose, guess what? It's one of the drugs that can lead to more kidney damage. So I tell people if they're on more than, we usually say now, more than 10 milligrams of prednisone a day, that it's time to go out to looking at other options. because of that dose there and above, we know it can do a lot of different things. It leads to higher risk of infection. It leads to higher incidence of COVID-19 and hospitalization. If somebody has lupus and lupus nephritis, it can lead to more organ damage. And the organs, not just the kidneys, it can be the lungs, the heart, and other parts of the body as well.
Okay, so Brandy has a question. If you get a kidney transplant, can the new kidney be affected by lupus as well?
Oh, so yes, it can. But remember, when you get a kidney transplant, you're going to be on anti-rejection medication. And guess what? Those anti-rejection medications are the same ones we use sometimes to treat the kidney disease. We treat the immunosuppressive the disease that we see. So it's very rare, but it can happen. That it can happen in the new kidney. But if people are on therapy and treatments for it, so they don't reject the kidneys, they're very less likely to get lupus inside the new kidney.
Okay. How often do lupus nephritis patients need routine lab work to monitor disease stability or disease progression?
I tell you, every 3 or 4 months, we have new guidelines which say to treat to target. So our target is of making sure their kidney function is, say if they got protein in the urine, we make that protein is to go down to 0. If they see blood in urine, make sure the blood goes down. If we see these markers like the creatinine level in the bloodstream. So we got several different markers that we look for in the blood and the urine. If they're abnormal, I'm going to treat every 3 months until those things go back into the normal range. So one of the nice things about, like I said, patients might not have to come in to see me every 3 months, but they go to the lab, get the blood work, and get the urine done. And then I can connect with them virtually, say, hey, these are results, this is what we need to do and monitor your medication. So they might only need to come into me every 4 or 6 months for a physical hands-to-hands physical examination, but every 3 months, like clockwork, we're doing the blood work and urine to making sure they don't progress. Because remember, people have lupus, 2 people walking the door with lupus, down the road, one of those people are going to get lupus nephritis. So 50% of those, and we want to make sure that we can catch that earlier rather than later and treat that. That's the most important thing.
Okay. Another question, does kidney failure always correlate to heart failure?
So no, not everybody who has kidney failure is going to have heart failure. But we do know if you have kidney failure, they can lead to other things like that. It can affect your blood pressure. You're more prone to having infections because it is a stressor on the body. And the stress on the body can actually lead to stress on the heart and on the brain. So cardiovascular events and heart attacks and strokes. If you take patients with lupus, even without lupus nephritis, the #1 thing that people die from is going to be cardiovascular disease, so heart attacks and strokes. And #2 is going to be infections. So another reason why if I have a young lady with lupus, I'm very aggressive in controlling her blood pressure. I'm very aggressive in monitoring her blood and urine every 3 months because I know if I don't, that patient can be in trouble down the road.
Okay. Here's another question. Peritoneal dialysis versus hemodialysis, is one better treatment for lupus nephritis?
So that's why I need the response from my my nephrologist, because it's going to be different people. So the peritoneal dialysis, many people can do that on their own. The hemodialysis, some people need to do that. They have to have that special access that the surgeon does to get that all in there. And that's what time working with the nephrologist. The good news, we're hoping with these newer therapies and things like that with aggressive control that we're less likely to see that patient have to go on to dialysis. But that means that patients need to be seen on a regular basis. If they're seeing a doctor and they're seeing these markers that are not getting better, or high doses of prednisone, that's the time to say, hey, to get a second opinion, say, hey, what would you recommend about drug A, B, C, or D?
Okay. So switching gears a little bit, with the vaccine in the news, is there any data or any information about people experiencing lupus nephritis, mild to serious, having any reactions to the COVID vaccines, any one of them?
So no, that's a nice thing about it. We just had some studies that came out from our European colleagues who to show, hey, that if you've gotten the COVID vaccine, that guess what, it doesn't trigger the lupus disease. And indeed, we tell people that most of our drugs, you want to keep them on as a couple of drugs we say to hold, so that your body can build up the right immunity to the immunization. But yeah, so first of all, everybody should get the vaccine. I tell people I'm old enough to remember things like polio and smallpox and even things like the measles and mumps that could kill people. But you didn't have as many people dying from measles and mumps, and people, hey, they have no qualms about getting the measles and the mumps vaccine. But as a physician, and I'm an immunologist as well, it's really frustrating. People say, hey, I'm afraid of this vaccine, I want to get it. And they talk about the blood clots. So like, I'll throw this out there. For example, for patients, who have COVID, for example, 20% of them, 1 in 5, going to have a blood clot. So 5 people with COVID-19, they walk into the emergency room, one of those going to have a blood clot. If you look at with the J&J vaccine, like we talk about, that's what they've had 15 cases out of 8 million, so that number is lower. It's actually less blood clots than you see on people who smoke and people on the birth control pill. And we also find too that the patients who get COVID, they might not die, but they have a heart attack, they have a stroke, they have these blood clots. So we tell people, whatever you do, get these vaccines. They shouldn't be afraid of it. I've had it, my whole family has had it, and you really want to get that, because at the end of the day, if you don't, it could be a walking time bomb. And just go back and look at the data on all these other vaccines. Real quick aside, people say, well, how did they develop this? How did they get it so fast? No, they've had this data for years. I was at Duke and working in the Vaccine Institute, and this came out of the technology, come up with a vaccine for HIV. Remember, HIV was bad in the 80s and early 90s, and they've had this technology for the last 20 or 30 years. So they took that technology with this new virus and say, hey, we see if we can turn out a vaccine, and guess what? It worked. The HIV vaccine, it turns out it doesn't work as well, and that's why they still hadn't gotten a great vaccine for that. But they've done the same thing for hepatitis and all these other ones, and nobody's qualmed about that. For HPV, for all, it's the same kind of technology that's out there. So in the old vaccines, you had to grow in chickens that took weeks and weeks. Now they can make these in a test tube. They can pump them out in hours to affect, the millions of people. But so the bottom line is the vaccine does not interfere with, it doesn't make the lupus work. There are some medications that you're on. If you're treating for lupus and lupus nephritis, it can interfere with the vaccine. So talk with your doctor about that. And at the end of the day, make sure if you do have symptoms that it might be suggestive of COVID-19, that you talk with your doctor.
Okay. How about pregnancy and lupus nephritis?
Yes. So good news that most people, when they get pregnant, that their disease gets under control. So here's a very simple analogy. So remember, your bodies with lupus, your body turns against itself. It fights the skin, the heart, and then the kidneys. When the mother has a baby growing inside of her, that's a foreign object, right? So God has designed it so the body's immune system kind of calms down. All of our disease almost go into remission. So rheumatoid arthritis, lupus, psoriasis, all those things go into remission when a lady gets pregnant, okay? And guess what, though? As soon as the baby is delivered, sometime, boom, the disease come back to rip-roaring. So what we say for somebody has lupus or lupus nephritis, before she attempts to get pregnant, we want to make sure the disease is under control. And again, the other caveat is sometimes these medications that we use that I would not want anybody to get pregnant on. So I have some patients, particularly under the age of 45, and they are sexually active, unless their partner or themselves have had been sterilized, the tubes tied, or a vasectomy. Excuse me. We do a pregnancy test every 3 or 4 months as well. So unfortunately, we do find a few patients who get pregnant even while on these medications, and that become a conversation that we have to have with them as well. So again, with pregnancy, you want to make sure the disease is controlled before you get pregnant. And if you do become pregnant or breastfeeding, there's some medication we have to avoid in those specific populations.
Okay. And then we got a question from Sonia. Isn't it true about all medications that they go through the kidneys and can have adverse impact? So
no. So the things that break down drugs in the body, for the most part, it's going to be the kidneys and in the liver. And so again, all depends on the drug and how they work and everything like this as well. But remember, the breaking down of the drug doesn't mean that it's going to impact the body. So like, for example, we have drugs now for the lupus nephritis, and they actually target those angry cells that are in the kidneys. We want them to get to that area. And that's the nice thing about them. So it won't have an adverse event. But because some of these drugs are broken down by the kidneys, if you don't break it down as well, then some of the byproducts, so the leftover parts of the drugs, they can build up into the system, and those can cause some side effects. So we say, hey, if somebody's disease, if the kidney disease is so bad that they can't metabolize even certain drugs, even things like ibuprofen or Aleve, we got to be very careful, because if you put those on top of those patients, then they can make them worse. So it's a double-edged sword. Some of these drugs can affect the kidney function, but at the end of the day, we want the drugs to get into the kidneys to treat the lupus nephritis.
Okay, great. We got another question from Brianne. Can meditation improve quality of life in lupus nephritis patients with chronic kidney disease?
So ask that again.
Can meditation improve quality of life for people with lupus nephritis and chronic kidney disease?
Yes, there's been some studies at Duke that's done so a lot of different things. So even talking to patients, even prayer, meditation, all those different things can help with many of our autoimmune diseases. Some of these things really do boost the immune response. We can see that with not only with lupus and lupus nephritis. And this is why we tell people, making sure you sleep, making sure you exercise, and make sure you're eating right, because all those different things that are there to help to kind of get the body, that you overall heal, the body tries to heal itself. And so using the drugs, sometimes we can help us out, but there are other things that make a dramatic impact on some of these patients, including meditation.
Okay. Yeah, you'd mentioned yoga and Tai Chi, which are kind of, you know, I suppose in the same vein or can be. So we got a question from Brandy. Is there anything for pain besides narcotics and NSAIDs that our lupus patient can take for pain?
Yeah, that's again, we individualize that as well. So there's a number of different drugs out there we can use. Sometimes we use some topical pain creams to help out. They're prescription ones that we use. I can tell you, everybody's out there thinking about, hey, can CBD be done? In Illinois, we have, of course, medical marijuana that can be used in certain patients, actually approved for patients with lupus. So that, yes, there are other things that are out there. I'm going to individualize that based on the patients, what other drugs are on, what other kind of side effects, et cetera, et cetera. We do try to avoid NSAIDs. Those are non-steroidals. Everybody knows ibuprofen, Aleve, naproxen, all those drugs, because we don't want those drugs to do more harm to the kidneys and also to the stomach as well. So yes, there are other things that are out there to treat the pain. You can actually talk to your healthcare provider about those.
Okay. Now I know somebody who's a caretaker for someone with lupus, and he takes his wife's blood pressure every day. Do you feel like there's value in taking the blood pressure every day, or is that recommended?
I think that's recommended. I would do that. I mean, like for me, I weigh myself every day. We check on our fevers every day, a temperature every day, and just like this for blood pressure. I have high blood pressure. I don't check mine every day, but I check mine at least once or twice a week, so I can know where my pressure and everything is. Because you want to say, hey, is it going elevated? If people are doing that, I do recommend, hey, maybe do it not just in the morning sometime, but sometimes the blood pressure goes up in the evenings. Sometimes it can be higher on the weekends and in the week. So you want to do it at different times of the week, just to kind of see if there's a trend.
Okay, so not just every day, but like don't just do it in the morning, do it in the evening or the afternoon.
Absolutely.
That's gonna be important information for you. So that's an example of a caregiver who's very engaged, who you were talking earlier about how important it is to bring somebody in with you when you have a meeting, right? And that's the kind of thing we would discuss with them. Here's another question. Who's most likely to diagnose lupus nephritis, the primary rheumatologist or the nephrologist? And that question's from LaShawn.
I'd probably say the rheumatologist, because we're seeing people more frequently. I'm seeing people, like I said, every 3 or 4 months. We're doing the blood work and everything on them. But I already know somebody has lupus, because I'm making that diagnosis for lupus. Then I'm going to be looking for the lupus nephritis. So a patient with lupus comes to me because they got a rash, some joint pain, and maybe abnormal blood tests. I'm going to be looking at the urine, and that's why I'll pick up the lupus nephritis.
Okay. All right. Well, we've covered a lot of ground. I don't know if we didn't really talk about you discussing this, but with the new drugs that are coming out, what can you talk a little bit about the process, not just for, you know, a lupus nephritis drug, but just in general, before a lupus drug gets approved, what kind of testing goes into it?
Yeah, so you hear us talking, this has been all really top of line now with the COVID-19 vaccine. We have the different phases of the trials, phase 1, 2, and 3. Phase 3 means this has been studied in a large population of patients, and one group of patients maybe get one drug and one group of patients get the new drug, so we can see how well these drugs work. That's one design. Another design is that everybody gets the common drugs that I mentioned on this page here, but then one group get all of these drugs, but another group get those plus a newer drug to see if the newer drug adds anything to above and beyond that. And that's where we are with treating lupus nephritis now. So we have two different medications that have been approved. They show that they do work above and beyond what these background drugs can do. And so again, talk with your healthcare provider about the different drugs, what's going to be appropriate for you, and how do you get those approved, et cetera.
Okay, so when someone has lupus nephritis or they have kidney involvement, you're their primary rheumatologist. At what point do you loop in a nephrologist?
Yeah, so first of all, if I see their blood test or the urine test is abnormal, I need to do a kidney biopsy, and that's why I get the nephrologist involved. And then based on what the nephrologist shows on the biopsy, then I'll have a discussion with that patient about the treatment options. Will it be any of these drugs on the slide, or will it be some of the newer drugs, et cetera, et cetera. So we have that discussion with these patients as we move along.
Okay, so when you see lupus nephritis patients, do you automatically, or just lupus patients in general, how important do you think diet is, healthy diet?
Healthy diet is huge. And like I said, it's not just for lupus, but for all of our patients. In my group here, I'm the director of our weight loss program. So we're really stressing that as well, because overweight patients can get not only heart disease and blood pressure and diabetes, but they can get what's called fatty liver. It can make their rheumatoid arthritis, the lupus, the psoriasis worse, et cetera, et cetera. So we really do talk about addressing all those different things. Because like I said, if you lose 10, 15 pounds, guess what? Your blood pressure gets better, your cholesterol gets better, your diabetes gets better, et cetera, et cetera. So once all those things better, I can do my job even better to help get the kidney disease from the lupus nephritis under control.
Okay. Here's a question from Chandra. How often should you get a biopsy, your kidney biopsy?
We do it if someone would help us make the diagnosis to see where they are. Classes, like I said, classes 1, 2, 3, 4, 5, or 6. And then we also do it at any time. Hey, wow, they're on all the drugs, but their kidney function is getting worse. Let me do a biopsy and make sure nothing has changed. So whenever we talk about going up on a more aggressive therapy, we do that biopsy to help us gauge that as well.
Okay, so it's really not, there's no schedule for it. It's just.
No, whenever you make a treatment, because I don't just do the biopsy just as, okay, now I got a biopsy, good, go home. I'm doing the biopsy when I'm ready to make a change in my treatment.
Got it. Okay. And then here's a great question from Brandy. How do you feel about acupuncture?
Oh yeah, acupuncture, really do believe in it. So at Duke, again, the randomized studies should show that it worked for weight loss, it worked for smoking cessation, it worked for hiccups. My wife had it for headaches. So we do recommend it. Now some insurance plans will pay for it as well. So somebody mentioned earlier on, that was something you can do for pain. So hey, instead of taking these narcotic medications or other things, do an acupuncture to kind of target those different areas where people are having pain, whether it's headache, neck pain, back pain, or whatever that is. Acupuncture does work. And like I said, now it's becoming more and more by insurance companies.
Is there any evidence to it benefiting lupus nephritis specifically or just in general?
No, because what the acupuncture does, it targets the nerves, it causes pain and all, makes you craving for smoking and things like that. It has nothing to do with the immune system, where it will affect the kidney function and decreasing the lupus nephritis. No.
Okay, so you've mentioned a couple alternative therapies that you felt like would be beneficial. And you mentioned yoga and Tai Chi, which are, I guess, not really alternative. Meditation certainly is, acupuncture, CBD oil. Are there any other alternative medicines that you recommend?
Those are main ones. I see things that other people use, which are more natural, turmeric, curcumin, things like that. All these natural products that are out there. But again, I tell people, try to find dietary things in your diet as opposed to a pill or a vitamin. So just by increasing like things like, pomegranate juice, things like that. It has natural tannins and things in it. So all those kind of stuff that you want to think about doing for your patient as opposed to just looking for a pill.
Okay. You also talked a little bit, and I was grateful for this, about how you talk with your doctors and about how patients talk with you. Do you have any advice for people who are meeting with a new doctor to kind of gauge their rapport? Like, do you have any kind of suggestions for patients that you have a good communication with that you feel like could be, helpful?
The first thing, say, hey, doctor, even go to your primary care doctor, hey, doctor, I want to think about, I say, you're looking at you, well, you might be borderline diabetic. Okay, so doctor, I'm borderline. Tell me what I need to do to prevent it so I don't go to real diabetes. And I just don't want to give me a prescription and go home. I need you to help me talk about some preventative things. There are 3 weight loss drugs out there. Doctors are not prescribing the drugs like they should. They don't recommend. They can write a prescription to get a nutrition or dietitian consult. It's covered by your insurance. So all those different things they say, hey, you need to go out and lose some weight and go home, instead of picking up their pen to do something about that. So you want to have that thing. So what's their approach? So again, when they start thinking about a pill, say, whoa, you want to put me on another pill? What can I do? So that's the first thing. And then so doctors say, hey, if I got a new diagnosis, I got, let's say even it's high cholesterol, what can I do on my side? What education can I do to help myself lower cholesterol and looking for my things? Because again, it's so easy for doctors to write a pill for a prescription and let you go home. It takes a little bit more time, a little bit more involvement to kind of help get other people involved, like the dietitian and nutrition, and think about things other than this medication. I don't like taking medicines myself. I take 1 blood pressure pill. But if they say, hey, I'm borderline diabetic, I'm going to be doing what can I do to make sure I don't go full diabetic? The same thing when it comes to lupus and lupus nephritis. You have lupus. I'm going to educate you about, hey, 50% can go on and get lupus nephritis. These are the things we need to do to make sure we can decrease your chances of going on to getting lupus nephritis. I need to see you every 3 months. I need to make sure you're taking your blood medication. I need to make sure you're getting your blood test and your urine test done. And then as you're doing those kind of things, guess what? Your chances decrease even more that you will not go on to get lupus nephritis. But with the new doctor, ask what their protocol is. What's the approach to just doing medications versus educating and doing a more natural thing? And just like Brandon put in the chat box, what about things like acupuncture? What can I do instead of pills? Other things like that to help treat my pain and my overall disease. That's the conversation without a doubt you need to have. It doesn't all happen at one visit. You might say, hey, I want to think about this. You want to put me on this drug for diabetes? Let me take a look at it. And then we make another appointment, it could be virtually, to talk about that versus other options. That could be another 15-minute appointment you make just to talk about that. Okay, Dr. Wells, I want to put you on this new medication. Look at this information. Let's connect again in 2 weeks. And we see you have any questions. Let's talk about whether the medication versus anything else. If they just write the script, okay, here's the script, see you back in 6 months, time to find a new doctor.
Okay. I did also appreciate earlier when you said that you'll write a prescription for the husband to do the laundry. I think you're going to get a lot of questions. A lot of questions. All right, so I'm going to do a last call for questions. I'm sorry?
No, I was going to say, that's why I say I make that joke, but we really do tell people because it's important for the family members to be involved so they can see the impact and everything on it. I'm not always a fan of having another family member in the room, particularly like a spouse, because sometimes that spouse will be talking more than my patient, or the patient might be talking more to the spouse than they are to me. So I might have them to leave the room while I do my part and have them come back in. Okay, now we're going to review everything. So that might be one approach that we can do.
Okay. So last couple questions, but we did get one. Anything you would recommend for energy boosters? That's a question from Chandra.
I'm on the fence about that. So that might be the one time I say there are prescription things that we can out there do as well. I don't like to mention specific product, but I will throw this one out. Or just in Whitman's this weekend, there's an energy drink called Celsius, just like the temperature Celsius. And it has some natural products and things like that. It doesn't have any coloring in it that can help to kind of boost your energy. It talks about, hey, if you're sensitive to caffeine, be careful of that because caffeine can sometimes make your heart rate and everything go up. The biggest energy boost is going to be doing the stuff we talk about, making sure you're sleeping well at night. Because if you're sleeping well at night, you wake up, you exercise for 10 to 15 minutes, you get that energy, those endorphins that bathe the brain to get you the energy from there. At the end of the day, if you're still having fatigue, ask your doctor the medication we can write for fatigue that we use kind of as needed, and doing more natural things in that regard. I'm not a big fan of things like this 5-hour energy or this monster drink and all this other crazy stuff, Red Bull that people are drinking. Those are just high in caffeine. You want to look for things that don't have caffeine type products in there.
Okay, wonderful. Let me just check my email real quick. I don't think we got any additionals. No, I think that's everything. We're a minute early, but I really just thank you so much. This was really a wonderful presentation. I appreciate all of your suggestions. And yes, we do have the walk coming up, so it's a great place to get some exercise and meet some people. We also have some awesome support groups. You can go to our website to find out more about that. And with that, I will say thank you again, Dr. Wells, and thank you, Catherine.
Yeah,
wonderful.
All the thank yous are coming through the chat box, so thank you all for writing the thing. I hope everybody enjoyed something, and I hope everybody learned something, can talk to their providers about, and talk with your patients who have lupus and lupus nephritis. So thank you all.
Thank you so much. All right, everybody, we'll see you next month, and be well.